Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hey, hi, everybody, and welcome to the Behavioral Corner. I'm your friend and host, guide here, Steve Martirano. What we do is we hang. I thought finally found something I'm relatively good at, and that's hanging on a street corner, meeting interesting people. That's what the Behavioral Corner is all about. It is underwritten by our partners, Retreat Behavioral Health. We rely upon them for a lot of insight and guidance when we do the corner, and that's certainly going to be the case today with one of their people from their New Haven facility. So we thank them for that. You know, before we get started and I introduce our two guests, we have the tendency as a society to focus on one thing at a time. It's just simple enough. If the thing's big enough, it takes all of our attention. This year, there is an opioid crisis that's justifiably got our attention. Now, of course, you know, there's the mother of all attention grabbers, and that's COVID-19. So we have a pandemic that attracts all of the attention and all of the media and all of our concerns. It's understandable. But sometimes what happens is that our attention is obviously diverted away from other problems, and never more so than when it comes to mental health. There is now and has been for some time a flat out crisis in mental health in this society that touches on all those other areas. And nowhere is that crisis more vividly obvious than in minority communities for a whole lot of reasons that shouldn't be surprising to anybody. But we're going to take a deep look at what those racial disparities kind of impact they're having in mental health as a disease and mental health care as a system and the program today, and ask the question, why? Why is this still going on, and what's being done to make it better? To that end, we welcome a great friend of this program, someone I met a couple of years ago up in New Haven, Jackie James. Jackie James is the Director of Public Relations for Retreat Behavioral Health in Southern Connecticut in New Haven. She has had a lifetime involvement in the public service in her community in New Haven in a multitude of areas, both in the private and the public sector. I'll let Jackie bring you up to date on that. She's done us a great good favor by introducing us to a new friend to the Behavioral Corner. Germano Kimbro joins us. He also has spent the better part of his adult life with as a community act. This is a great phrase, and I've always loved it. He is a change agent. He's been involved at the grassroots level in many of the areas we're going to talk about today. Most recently, through something called the Ministerial Health Fellowship Advocacy Coalition, spearheading a COVID-19 crisis program that he's a counselor in right now. I want to thank and welcome Jackie and Germano to the show. Whew, I'm out of breath. Okay, I'm out of breath. Wait a minute. Let me drink some of my orange soda that I got from the store. Jackie, how are you? It's good to see you again.
I'm doing well, thank you. I am doing well despite.
Yeah, I know. Remember when the statement "How you doing" was a sort of rhetorical question?
Yeah.
Now you got to stop and let the other person answer, right?
Yeah.
So, Jackie, let me see if I got my definitions right. There's a mental health crisis in this country, correct?
Absolutely.
Yeah.
Absolutely. And we've had a mental health crisis for many years, for decades, but I think COVID has kind of lent itself to just exhausting, the mental health crisis to some extent.
Yeah, this disease, in addition to everything else it has done, has made everything else worse.
Yes.
And magnified the problem. And we mentioned, and I know Germano has done work in the field of substance abuse and overdoses and everything. COVID has had a devastating effect on that aspect of the community, correct?
Well, without a doubt. It's interesting. There was just a presentation this morning where they said that substance abuse and mental health has increased from 32 to 53%. So, anything that was underlying has really come to the surface. And so when you have the average, coworker and colleague that just was managing, stress on a regular basis, and now, find himself in a pandemic fatigue. And so it's typical of what's happened in 9/11 and anthrax and other kinds of disasters that happen around the country.
We said we were going to take a look at the disparities in the mental health system in minority communities because it's important. And it's always both depressing and sobering that whenever we talk about a problem that affects the entire society, we have to make note that it is affecting certain segments of the population much, much deeper and much more profoundly for a lot of reasons. The disparities that I've been reading about are pretty well documented. Can I begin with a couple and you tell me if I'm hitting the right notes here? First and foremost, and either one of you, both of you can answer, there's just a simple lack of access in those minority communities, correct?
There's a lack of access, but I still think there's a issue with regards to institutional structural racism. I think that people of color are disproportionately on the front lines, right? So there's a lot of inequalities that's just not being taken into account when it comes to addressing some of these issues with regards to mental health and COVID, right?
Yep.
I think that's the reality. And I think some of those realities are really not being talked about or addressed.
Yeah. Germano, what's your experience in the streets and everything? I mean, look, where I come from, I got a minute clinic a minute away. I got my doctor who I pick up the phone. I mean, I got a lot of access. It's not always the case in the neighborhoods you go to, right?
Well, I think that, the effects have been insidious. So we were already in an epidemic with, the opioid crisis, throughout America. But I think Malcolm said, when America gets a cold, Black America gets the flu. We have become accustomed to, dealing with adversity. And so I don't think that people really took the pandemic as serious as they should, for whatever reason. Minority and people that are affected by poverty, have been accustomed to just doing the next best thing, in terms of survival. It's just unfortunate that, like Jackie mentioned, just systemically and institutional, there are just some pieces that are not in place prior to this. And so it's like the perfect storm. I mean, these issues are compounded when you take the issues of poverty that face, Black America, and then you put an epidemic on top of it, and then a pandemic. It's almost like the perfect storm. And so there's no question why, we're dying at a higher rate and not getting vaccinated, and the hesitancy, coming out of a political era that we just came out of. I think that just, it's just a real rough time. And so when I'm out there, because I have a relationship with the community, because they've seen me, kind of progress through many stages of life, I become a trusted messenger. And so I don't convince or try to sell anybody one way or another, whether or not to take the vaccination, whether or not to wear a mask. I present the best information and let them make their own decisions. And it's tough. It's an uphill battle. And, they have the same needs that they had prior to the pandemic. It does become a tough sell. So we're having a lot of success working through the houses of faith. And I think that was one of the reasons that, the Ministry of Health Fellowship has been so successful, because, the church has been kind of the backbone and the cornerstone and the foundation of, the Black community. And so they have been pushing to make sure that, we have, greater access. They've been doing a phenomenal job, and they've been able to turn some of the churches into clinics, and the elders up until this point have been, more willing to come into the church for a vaccination as opposed to a site. So,
Is it Henry Louis Gates or Louis Henry Gates? I forget. He's doing a PBS special on the history of the Black church, which is going to be worth watching. They have always been there, and they're there again. Let me ask you, with regard, you grew up you both grew up in Southern Connecticut, right? You're both from New Haven?
Yes.
So, I don't have to tell you about the justifiable suspicions that exist in communities like that when, the larger society says, hey, you should do this. We need you to do this. In this case, it's, mask up and get this vaccination. When you talk to young inside the community, Germano, are you getting a lot of pushback on that? Are they going, no, wait, I'm going to wait, or what's going on?
It's like pulling teeth. I mean, even with my own family, I mean, they'll find the one reason why, or the one person that failed as to, why not to get vaccinated, or why, this virus isn't real. And it's just another thing that, the government has put together to make money.
Right.
It's really tough. I mean,
well, minority folks are not alone in that sort of, golden age of suspicions of the government, but they have a particular bias because, of the history of things like the Tuskegee experiments. And that may have been 100 years ago, but it's still a real thing, right? They're suspicious.
Yes, suspicions are due to a lot of miseducation and a lack of education, right? So, and I don't think it's just the Black community. I think what we're also finding is that elderly amongst various racial backgrounds are also suspicious of the government and taking the COVID vaccine.
Yeah,
right.
Yeah, right. I wonder how philosophical minority communities can be about the fact that they're very often, almost always, at the end of lines and not at the head of lines, to suddenly find themselves designated as essential workers when this thing hit. That must have been like, really? We're essential workers now. Did they roll with that? They just kept doing their jobs? What was the reaction you were seeing from the minority communities at the beginning of this pandemic?
Well, they couldn't afford to take a day off. I mean,
exactly.
At all.
Right.
They were essential workers. They couldn't afford to take any day off, right? They had very little benefits, whether it was benefits from their work with regards to taking time off or medical benefits, right? Childcare was a major issue. So it became a situation where everything was just beginning to fall apart in many people's lives, but they were considered essential workers, right? And companies, corporations got funding to provide some level of assistance, and many of them did not, right? And they're still considered essential workers.
In that vein, let me ask you both that if it's not also true that because of everything you just described, that community is less likely to even look to get help.
So what I've seen and heard in the community where I am from, they have sought help. So I know with Black-owned businesses, the PPE loan program or grant program has been limited. The CARE program has been limited, right? Providing rental assistance has been limited, and it's been limited because of access. It's been limited because it's bogged down by red tape. It's difficult, right? So when you have a community that's already suspicious, when you have a community that's already burdened and laden with a whole lot of other things, then yeah, it becomes a bigger and broader issue.
One of the things that we were talking about before we got on the air is among the many things that Germano is about. He's very active in putting fathers back into the equation in these situations. Tell us about your work with low-income families and fathers.
Well, that work began around the end of time-limited welfare, where we had the Personal Work and Responsibility Act that Clinton put in place. And so we were trying to find a way to help support women that were being placed on time limits. And so there was no infrastructure. We found out that, poor men and fathers need the same services that poor mothers needed, and that there were men that were engaged, yet they didn't participate in the formal child support or social service delivery system. They hadn't begun to receive them. And so being able to carve out pathways to access services for men and fathers became the first task. But it was interesting because it was during the time I was doing my undergrad, and I actually did a research project on how men access services. And so even though those men and fathers had jobs, they didn't take time off or go to the doctor until their health reached a chronic or acute state. And that research also showed that they receive health in three ways. It was actually through the military, emergency room, and jails. And that work was published in the American Medical Journal under the coloring of an African American male crisis. And so that work with fathers, I think, was very significant. It was one of the things that was probably most noted in New Haven in terms of Black men really stepping up to the plate to meet the emotional, social, and financial responsibilities for their children. We actually changed the game, like DCF now is a major partner. So we had these institutions that weren't talking to each other, or they were looking at men and fathers as a wallet, Department of Social Services, where, they received benefits or they was automatically giving child support. Even the men that were incarcerated, how they had these huge arrearages that just kind of crippled them, of their life. And so we was able to develop legislation and, change some policies and get a system that actually functioned, to bring a family together. And
give these men not only the means and the opportunity to support their family, instead of just, as you say, grabbing their wallets because of the money. There's a huge relationship between successful outcomes in minority situations and having two parents in the household, right?
Father involvement is one of the key, most important factors in, healthy child development. I mean, there's no doubt in my mind you need both parents.
As I scan some of the stuff that I've been looking at with you guys, Germano, one thing stood out. Tell me about the Ice House curriculum. What was that?
Well, that's Jackie and I partnered. It just happened to be one of those times where she was director of small business and economic development for the city. And I pitched her an idea and she bought into it. I told her I wanted to do a youth entrepreneurship program. The city didn't have enough money for jobs. And I knew that, every kid wasn't going to be able to job. I knew that, poverty was definitely connected with violence. And if that we can reduce the poverty, we can help reduce the violence, and that, kids need to learn to make their own money. And so we was able to partner with the state small business and economic development. Jackie can chime in, but they came in with the Ice House curriculum, and we was able to put together a youth entrepreneurship program, and was highly successful. In fact, some of the ideas that, the kids developed are implemented in the city now. They were taught how to monetize their ideas, but I was able to also be trained and certified to take that curriculum and into other social service agencies, around the state, the Urban League in Hartford and Community Action Agency in New Haven.
Jackie, where'd the name come from? What's the Ice House?
So the Ice House motto is basically, as an entrepreneur, it's a niche business. You build your business based on the need. And there was a gentleman who was in a town and the town needed ice. So he built an ice house. You meet the needs of the community, and that's how you build your business. We don't need 10 more corner stores or 10 more McDonald's or 10 more package stores, but what are the real needs of the community, and how do you again monetize that idea and meet the needs of the community as an entrepreneur and as a business owner?
With regard to that, Jackie, you spent more than a little time in the halls of public service. Somebody said if you saw the way laws were made, you'd run away screaming. It's like making sausage or something. So you know how it works inside there. You certainly know how it works in the private community. Look, there's not going to be a lot of money sloshing around in this economy once we come out from under this pandemic. Are we getting the kind of cooperation from the private sector and the political sector to address these problems, these enormous problems?
I am very hopeful with this current administration. I do think we will begin to see the dollars coming into the community. However, once they get to the community, it is up to us to ensure that they are utilized and go where they are needed. And often you don't see that, right? So I think we need to continue to advocate for resources. And I think we need to continue to communicate our needs, wants, and desires with elected officials in regards to what the community needs, what the community wants, and how that is going to work.
I'm astonished that there's still an argument over with regard to how big you should go here. It's mind-boggling to me that we should see the biggest problem in maybe 100 years and have people advocating that smaller is better than, you got a big problem, you go at it big time, right? So yeah, I hope they do. But you're right. Once the floodgates for money start trickling down, once they get to the level you guys work at, it's incumbent that you make sure it gets where it's got to go.
Exactly. It's incumbent that we all ensure that it gets where it goes.
All right. Finally, with regard to the mental health thing, I want to swing that back to this now. Germano, what's happening with regard to homelessness in New Haven? It couldn't have gotten any better because of this.
Unfortunately, New Haven has been how can I put it? It's been a hub for homelessness. And so we've taken on the lion's share of the state's homeless population with a number of shelters. And unfortunately, they've closed. And so they've been housing them in hotels. And then with the combination of COVID and substance abuse, I drove by one of the warming centers yesterday, and the ambulance were just rolling in because we had 3 deaths yesterday, that happened right in the hotels. And, it's an all-time high, amongst that population. And so it's tough, and kids, that had the opiate problem that came down from the suburbs. And because New Haven hosts a lot of the homeless population, it's just really bad.
The other area that impacts homelessness profoundly is that mental illness is a huge component as to why some people wind up on the street. We have now serious schizophrenics who are homeless and they're on the streets. And among the other disparities that I think has occurred, you tell me if I'm wrong, is that there seems to be some wider perception that schizophrenia is now a Black disease. Do you know what I mean?
Well, I think that, what happens in the African American community, because mental illness is seen as something that's taboo in some of the earlier medications like Thorazine, kind of put people in zombie mode. And so they didn't access, mental health services. And so like I was talking about the disparities in just accessing health in undergraduate work, when it came to mental health access, it was almost like taboo. And so again, they don't go in, when, the mental health is a level of stress and anxiety or even depression. And then by the time that, it becomes diagnosed, it's usually an acute stage of schizophrenia or, bipolar depression and some, major affect that usually requires, heavy duty medication and hospitalization.
Well, whenever you tackle something as large as this issue of a mental health crisis and the disparities racially in that regard, there's never enough time to really do the topic justice. But I do want to thank both of you for the time we have had together, and we'll have you back again real soon. Germano Kimbro and Jackie James. Big topic, not a lot of time, but I want to leave people with my impression of what I've just heard, and this really is encouraging. You guys are hopeful.
I am very hopeful. I am.
Well, I'm extremely grateful to Retreat, because there are community beds there that are available. And so as I do outreach and engagement work, I got somebody that I can pick up the phone and say, I have somebody that needs a bed, and, Jackie can make that bed available, through Retreat. And so that's a start,
Terrific, guys. Thanks so much. And I hope I can call upon you again. Continue your really valuable work. And catch you next time on The Corner, okay?
Studies show that 2020 has negatively affected the mental health of millions of Americans. That is why at Retreat, we work to provide comprehensive mental health programming through our Synergy Health programs. To learn more about Synergy and the comprehensive mental and behavioral health services we offer, call us today at 855-802-6600.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.